Everyone, let's change the topic now. I'm here, Dr. Kalsoom Jawaid, Senior Registrar, Dermatology Department, DHQ Hospital, Faisalabad Medical University. And my topic for today's discussion is material and designs of threads. In this era of flourishing aesthetic dermatology, where many of the older procedures are refined and many of the new procedures are being developed, some of them are quite temporary, like Botox and fillers, which have effect for HA fillers especially, which have effects for months and they need to be repeated. Simultaneously, some of the procedures do have quite promising results as if we consider the longer lasting results, like threads, some of the threads. So focusing on threads, many of us are very fond of it, but ironically, many of us are quite unaware of the basics of threads. So I wanted to highlight the basics of threads. Regarding this picture, I'm very fond of it. I show it to my junior colleagues just to make them understand that if you want to write something or if you want to do something on patient, you must know your pen. How can you proceed without the knowledge of your pen? What can it write? How will it proceed? What are its limitations? What will be its extent? So, do focus on your pen first before opting for the actually performing the procedures. Starting with objectives, I will try to cover what are threads made of, what are the type of changes they can induce, what is their real efficacy, and what is our aim to treat with threads. Starting with the classification, how we can classify the threads. We can classify them according to the type of the filament, whether it is mono or polyfilament. We can classify it as mono or polyfilament. According to morphology or topographic features, threads can be plain, spiral, embossy, cogged, and cones. While the most widely applicable classification is according to the absorption. We must know whether the thread gets absorbed or not. The non-absorbable threads used to be classically, historically, the gold and platinum threads, not used nowadays, but others, which are permanent and non-absorbable, but in some use nowadays are nylon and polypropylene, that is proline. They are both quite widely used in surgery, not much in dermatology and aesthetics. The other ones are absorbable ones. They may be, according to their origin, they may be natural ones or synthetic ones. The natural ones will get absorbed by a hydrolytic process or enzymatically. Natural ones will get absorbed by enzymatic processes and synthetic ones will get absorbed by hydrolytic processes to carbon dioxide and water. Starting with the nylon, which is the non-absorbable thread, as I mentioned, it's monofilament. It comes as a monofilament and coated multifilament too. It is synthetic, is used extensively in surgery. It is quite inert when placed in the tissues. But it is strong enough, it can cut through the tissues if it is held in traction. Next comes proline. Is also non-absorbable synthetic monofilament, but it has got high memory with very low tissue reactivity. It is more suitable for suspension because it is totally inert. It does not cause fibrosis at all, and if you place it, you can eliminate it even after many years unchanged. So it is best for suspension without fibrosis. It won't cause fibrosis where you put it. Then we move towards absorbable threads, which do have practical implications in our practical aesthetic dermatology. The natural ones, as I mentioned, get absorbed enzymatically via esterases or enzymes, and synthetic ones get absorbed by hydrolytic processes. Starting with each one of them. Polyglectin 910, which comes with the name of Vicryl. It is interwoven, colored polyfilament, but it has got risk of infection more than the other threads. It gets absorbed with between 2 to 12 weeks if you inject it into the body. While polyglycopron comes with the name of monocryl, it's monofilament as compared to the Vicryl. It is excellent for dermis and subdermis. It has got reduced capillarity, reduced bacterial adhesion, but it gets absorbed within 1 to 6 weeks only. Then comes with polyglycolic acid. It gets absorbed between 2 to 6 weeks. It is one of the alpha hydrolic acid. It is a polyfilament basically and is biodegradable with enzyme and hydrolytic too. It is thermoplastic. When it gets heated, it converts to plastic, and when it gets cooled down, it converts to solid. It loses 50% of its resistance in 2 weeks and 100% of its resistance in 1 month. It is completely absorbed within 4 to 6 weeks. So not pure form of polyglycolic acid is not that good choice for threads because absorption time is quite low. Its copolymers do have increased strength and sustainability in the tissues. Let's discuss its copolymers of polyglycolic acid, that is polylactic acid. Its speed of degradation is ranges from 90 to 120 to 180 days. It has got added effects of fibrosis due to strong macrophagic action when it is inserted into the tissues. It is biodegradable, and it is, if you remember, it is also used as a filler, and it has also got a lifting effect when after injection. Then we move towards poly-L-lactic acid. It is L-isomer of polylactic acid, is also biodegradable, biocompatible, and biologically inert, while it is a synthetic polymer. Poly-L-lactic acid microparticles, they initiate new collagenesis around them as a result of normal foreign body reaction. The buildup of collagen over time, that it creates this volume at the site of their injection, while it also gets metabolized to carbon dioxide and water. The last is Dexon, polyglycolide cocaprolactone. It is highly tolerated monofilament. It is absorbable through hydrolysis, also bioabsorbable and biodegradable, and its barbed form is there in the market, which is used to suture the skin and subdermis without suture knots. PDO threads, conventionally speaking, are absorbable, synthetic, and monofilament. They have got antimicrobial effect. They don't have much chances of infection. They are biostimulating to produce new collagen. They have little capillarity, and they are relatively inert. They don't cause much inflammatory reaction. Their inflammatory reaction, what they cause, is quite less than other substances. They are highly tolerated, excellent biological tolerability is there. Their total absorption time is much better, 6 to 8 months. It loses its strength of about 70% at 2 weeks, 50% at 4 weeks, and 25% at 6 weeks. Here is a comparison of all of them. Starting with polyglycolic acid. If you see, it gets absorbed. Its total retention time is, you must focus on the second category, PDO and PLLA. The PDO lasts for about maximum 5 months, while PLLA can last for 9 to 18 months. It was all about the basic material of threads. Now, how are they being designed? What are the morphological types of thread? And this classification can be applied to any material of thread like PDO or even PLLA. This is the basic presentation, how the thread is prepared. The thread can be mono, it can be